Thank you all so much for joining us again today, whether this is your first webinar viewing with Consolidated Planning Group or your 31st or anywhere in between. We are so happy you're here. I want to tell you a few things before we get started. First of all, gosh, I hope my voice isn't as annoying to you guys as it is to myself when I watch these back. Oh my God. I'm so sorry for that. But I know everyone hates their own voice when they hear themselves on a recording. Listen, we do record all of our webinars and we put them on our YouTube channel after we're finished with the presentation so that they're out there for you as a resource library to be able to watch whenever you need. You can also share these with your family and friends or anyone who you think might benefit from these webinars because we do work all across the country. So it doesn't matter if you've got someone in a different state, please send them our information. We can certainly help them. The other thing I want to let you know is that the reason we're testing out the chat box by putting in our favorite movies is because I cannot hear you or see you as participants. All I can do is use the chat box to get your questions answered and to see your comments. And I love your questions and comments. So please put them in the chat. We are going to be using that to get your questions answered. And that's how you will ask questions during the webinar is in the chat box. So since I can't hear you or see you, we're going to be here for about an hour. You might as well enjoy your lunch, have your snack or your drink or whatever. I've got my coffee here still, so I'll be sipping on that. All right, let's dive in. So first of all, a little bit about Consolidated Planning Group. You know, we have over 30 years of experience in financial services. Anything that any financial advisor could do for you, we can too. We do life insurance, investments, securities, retirement planning, all of that kind of stuff. But we take it a step further because we are parents to loved ones with needs. And we've been through the process and we understand what needs to be done to set yourself and your loved ones up for success. We've incorporated that into our practice. So we are chartered special needs consultants, members of the Special Needs Planning Academy, and nationally certified Social Security advisors. Not only do we work this every single day, but we live it because we are all parents. All of the advisors at Consolidated Planning Group are parents to children with needs. So we take this very, very seriously, and we are able to provide a different perspective than other financial advisors. So people specifically come to us for financial planning because we can help them with that extra level of lifetime care planning for their special needs children. Planning transitions, like when they turn 18, when they graduate from high school, when they move out of your home, when you pass away. There's a lot of different transition planning time periods that you're going to go through. We can help you understand what needs to happen at each of those transitions. We also help with ABLE accounts, waiver programs, how the money should flow from bank account to special needs trust or to ABLE account, or how exactly this is supposed to all work for you. We also help families with estimating that future cost of care. So, you know, right now you are here and you're helping to take care of your loved one, but when you're gone, you want them to receive comparable level of care. And you're going to have to pay somebody probably to help take care of your loved one. So what is that going to look like? And how much is it going to cost? These are answers that we can help you think through. State and federal benefits, you know, applying for benefits, appealing benefits if you get denied, when and how do you do all this? What does that process look like? Not only do we have the mechanisms in place to help you through it, we also have an advocacy service where if you don't want to deal with SSI or SSDI applications, we can do that for you now. We can also help you find local resources. Basically, we are here to advocate for families and to educate families. We truly believe at Consolidated Planning Group that the more educated a community is, the stronger they are. So I appreciate all of you being here to become better advocates for your loved ones and for your families and to help your friends and neighbors and communities thrive. You know, there are over 263,000 financial advisors all across the United States. And out of those, less than a tenth of those financial advisors focus on special needs planning. A tenth of a percent, I'm sorry, is what I meant to say. Less than a tenth of a percent of all the financial advisors in the United States can help you with the special needs planning the way that we do. So we are here to help provide really comprehensive, holistic look at your family's future and what needs to be done. And it's so, so important that you use one company to help you monitor all of these things, to guide you on your journey and make sure that everything is taken care of. The left hand and the right hand are talking together, and that someone's not doing something within all of your planning that's going to jeopardize something else that you've done. That's why we truly want to be a one-stop shop for your financial needs. Some things to think about as it relates to supporting your child and doing this planning work is right now is the best time to start. People often ask us, oh, my child is 8 years old or 18 or 38. It doesn't matter. Right now is the best time to get started. The earlier, the better, because you're going to have a longer runway to make small incremental changes that are going to have a big impact on your plan. So if you get started now, while you're not stressed, you've got time to plan, it's going to be much, much easier than waiting until the last minute when things are stressful and you have to make quick decisions and you might be pressured into making the wrong decisions. So start now. Think about what's going to happen after high school for your loved one. You don't want them to graduate to the couch or to the tablet or just the video games. What's going to happen? Are they going to attend another educational program? Maybe they're going to go to day and transition programs or go to work. There are a lot of great work opportunities out there. Maybe it's a good idea for you to start looking at residential opportunities for your loved ones, because you're not going to be here forever. Take care of them. At some point, they might need a residential community. And if that's the case, getting them involved early is one of the best ways to do that. Finally, we want you to think about who is going to take care of your loved one when you can't do it anymore. And I did mention communities, residential communities. Some people think that a sibling is the right answer for a successor caregiver. We just want you to be very careful when you think about that, because it can cause some drama on both sides of that equation, right? So just be very careful if you think a sibling is going to be the best answer to take care of your loved one. So we're going to jump right in today to Government Benefits 101. There are a lot of topics we're going to cover. It's kind of a rapid-paced webinar, but feel free to put your questions and comments in the chat box. I do have some questions that were sent in ahead of time here on my phone, so if you see me peeking at that, I'm just trying to make sure that I work those questions into the presentation and get everyone's questions answered. All right, so we're going to be talking about the waiver programs, SSI and SSDI, when to apply for benefits and how, and ABLE accounts in your special needs trust. So there's a lot to be thinking about. And again, you can go back and watch this recording later. So just to give you a general timeline of how things should happen, early in your child's life, you're going to notice that something's different. If you haven't noticed that, you're probably not here yet. You're not even watching this webinar. So you've noticed that there's something different you're looking for, or you've received a diagnosis from a medical professional. As soon as you know, or even suspect that there's something different going on and that there's a diagnosis, you can go ahead and apply for the waiver waiting lists here in Texas. In Texas, the wait for the waiver programs is between 17 to 20 years right now. So get on that wait list as soon as you know that there's a problem. You do not have to prove that there's a disability until the child's name comes up and they're ready to offer you services. So go ahead and get on those wait lists for the waiver programs. We'll talk about those a little bit more, but we also have entire webinars dedicated to the waivers that you can go look up. Now, hopefully when they're young, you've signed them up for the waiver services, but whenever, that's fine. I just want to let you know, in other states, we do talk a lot about Texas because that's where we are, but Consolidated Planning Group works all across the country. So I want to point out that in other states, there is not such a huge waiting list. You can move to another state and be able to apply for benefits and get them within only a couple of years or a couple months. And they're not all like Texas. Now, most children won't qualify for SSI until they turn 18. We'll talk a little bit about why that is, but you should apply for your child's SSI the month after they turn 18. We'll talk about that. Then later, after they've received SSI, which comes with Medicaid, hopefully, this is the timeline that you work through. After that, when you as a parent turn on your Social Security benefits, that's when your child will switch to SSDI or a childhood disability benefit. So I do see two comments in the chat box. Let's just see. Can an adult who is 19 years old with high spectrum of autism, eligible, despite immigration status? So if your child does not have a Social Security number, unfortunately, they are not going to be able to receive SSI benefits. You might be able to get Medicaid or other benefits, but SSI is not available to non-citizens. Erica says, I recently helped an 18-year-old's family call to get on the wait list, and his position number was 93,000. Yeah, it is heartbreaking to know that there's just not funding for these programs. And what I want to say about that is call your representatives. That's the only way we're going to get anything changed is to speak with our elected officials and tell them that this is unacceptable. Okay, so the first thing I talked about is to get your child on the waiver wait list. It's also called an interest list. And you need to do this as soon as possible. If you're not on the waiting list yet, you can take care of this in 5 minutes. There's no reason for you to wait for any other day. Today is all we have, right? So the first set, MDCP, CLAS, and DMDB. You get on those waiting lists by calling the 877 number listed on the screen, 877-438-5658. Now, those three waivers, MDCP is for medically dependent children. Not everybody's going to qualify for that. DBMD is for deaf, blind, and multiple disabilities. And not everyone's going to qualify for that either. But everybody qualifies for CLAS. Whether your child has an intellectual disability or anything else, any disabilities qualify under CLAS. So everyone here watching this webinar or listening or watching on YouTube needs to call this phone number and at minimum ask to be put on the list for CLAS. Next, you need to call your local intellectual and developmental disability authority. We sometimes refer to that as your LIDA, or maybe people say LIDA. This would be something like MHMR, Bluebonnet, Tri-County Health, the Harris Center, Texana, ACOG. I'm trying to think of what the big ones are called around the state of Texas. You might have heard of those. Maybe you don't know who your local authority is. If you're in Texas and you call 211, they will help you find your local authority. or you can use the link here on this slide. When you receive these slides later on today, that link will be clickable. So you must call your local authority and ask them to be put on all of the waiting lists for the waiver programs. Everyone in here needs to do this if you haven't already. Now, the third phone number on this list is not for everyone. This is for people who have an individual in their life who is 21 years or older. That's what Star Plus covers, 21 and above. If you have someone in your life who is 21 and above, you can call Star Plus at 877-782-6440. Now, once you've called these 2 or 3 phone numbers and requested that your child be placed on all of these waiting lists, I would give them a little bit of time to make sure that information is input, but you can go to yourtexasbenefits.com, create an account for your child or individual, and then look in there and see where they are on the waiting list and what lists they're on, and get more information that way. So once you log in under their information on the yourtexasbenefits.com, you'll go to manage and then interest lists, and you can see where they are on the list. So, all right, so a couple of notes about these waiver programs. These are the 4 most popular waivers. Class, again, it serves almost everybody. It's one of the most well-known waiver programs. Class serves people who have a disability that started before age 22. That's important to remember. And the disability needs to affect that person's ability to function in daily life. But they are the broadest in helping the most people. Now, HCS is another very well-known program. They can help pay for housing in the future, and that's a great benefit. HCS has some of the largest pockets of all of the waiver programs. They provide the most funding to families, but not every family needs it. So, HCS is great, but if your family doesn't need it, maybe leave it for people who really do. Community First Choice. This can help provide attendance services and supports to Medicaid recipients. Key, Medicaid recipients. You have to already have Medicaid for Community First Choice. And then there's Texas Home Living, which provides services to people who want to stay in their own home or in their family's home. It does not provide payments for housing, so it's kind of like HCS Light. Now, there are some more specialized waiver programs, and I mentioned these a little bit. DBMD, that's for people who are deaf and blind and have another disability. So not very many people qualify for that. The wait is going to be a lot shorter for that one. MDCP is similar. MDCP is for medically dependent children. Fragile, medically fragile. And this is one where sometimes we see parent will call and you come up on the list pretty quick for this one, but then they say, well, your child's not really fragile enough to need this waiver, which is disheartening, but it is what it is. Wait for the next one to come up. The YES waiver is more specialized and quite different. YES waivers focus on people who are under age 19 that have a mental condition, mental, behavioral, emotional difficulties as their main diagnosis. This is not someone who has autism and ADHD, and because of that, they also have some anxiety or depression. This is someone whose primary diagnosis is something like schizophrenia, bipolar disease, something like that. And then there's Star Plus. Star Plus is for those medically dependent children once they turn 21. They'll switch from MDCP and be able to go over to Star Plus for services. All right. If you have any more questions about the waiver programs, please put those in the chat box and I'll get those. But let's look a little bit further into the differences between SSI and SSDI. Remember, SSI is a public assistance program. It is funded by general tax revenue, not Social Security. SSI stands for Supplemental Security Income. It's a needs-based program. You do have to be financially needy, but it does not require that you have any work history or anything like that. But the rules for SSI are very strict in terms of asset limits, income, and you have to have a disability. So it will pay you monthly benefits, especially, low income, limited resources. As a matter of fact, you can only have about $2,000 in the bank if you want SSI benefits. You can only make $1,690 a month. And this is why generally people do not qualify until they turn age 18, because before age 18, they're going to look at the parents' income and assets. After age 18, they only look at the individual's income and assets. And if your kiddo is not working, it's easy to keep control of those. Erica wants to know, how do we get on the CFC wait list? So CFC is available through your local authority. When you call them, you'll be added to that program wait list. Okay. Now, SSDI, different program from SSI. Even though they sound very similar, SSI is supplemental income. SSDI is Social Security Disability Income. And what this is this is the insurance that we all pay for through our paychecks. We're paying into Social Security to earn this insurance. Now, as adults who do not have disabilities, we can turn on SSDI if we become disabled. When we pass away, this switch happens, or when we turn on our Social Security retirement benefits, because, we're in our late 60s. When the parent turns on their retirement benefits through the Social Security Administration, our children can draw benefit based on our work history, especially because they're not going to be able to have enough work history to have their own benefits. So this requires that the person is under a parent or someone else who has paid into Social Security and has enough work history. Qualification is not dependent on the recipient's work or their assets or income. And this provides that benefit that it was called DAC for the longest time, disabled adult child. And then it was called, now it's called childhood disability benefits. Some people call it SSDI, some call it RSDI. Those are all kind of the same things. Now, to be eligible for SSI, you have to follow these three very important rules. You have to be considered disabled under the eyes of Social Security. So you're going to have to provide medical history, notes about your individual's functional abilities, and doctor's information, all of that stuff to prove the disability. You have to keep their bank account below $2,000 at all times. And this is very, very important for SSI. It's also a rule for Medicaid. So if your child gets a Medicaid waiver, there might come a time, especially maybe once they've switched from SSI to SSDI, that they don't need SSI anymore. And you think, oh, well, now they can have more than $2,000. No, don't do it, because then they could lose the waiver programs under Medicaid. They need to be working less than substantial gainful amount, SGA. For 2026, that amount is $1,690 a month. Now, if your loved one is blind, they can earn more money. They can earn $2,830 a month, but you have to stay under that limit to be able to receive SSI. If they're working a little, they can still get SSI, but their benefits would be reduced. They are also allowed to have one house and one car that don't count against them. So, thinking about that SSI application, it's best if you apply the first day of the month after the person's birthday. So if your loved one's birthday were today, I would wait until August 1st to go ahead and get that SSI application started. They will back pay you once they finally get the application done and approved, and that could take 6 months to a year. But once they finally get it approved, they'll back pay to the date that you started the application. There's a link right here for you to go to the Social Security website and get that started. So you can reach out to us if you have any questions for your SSI application. And again, if you don't want to do this at all, we do have a service now where we can do the SSI application for you. So again, when you sit down to fill out your SSI application materials, you're going to need to have evidence that there was a disability that started before age 22. It's really important that you have proof of that. The doctor's office will, usually be the source for that, but they would also take information from schools or psychiatrists, other doctors, things like that. Gather up the names, addresses, phone numbers for all the doctors that your child sees. They give you space for 5. So start with the most recent, okay? They'll also want to know what medications your loved one is on, what they're for, what the diagnoses are, things like that. They're also going to want to see financial information to make sure that you follow the financial guidelines. So if your loved one is working, they're going to want to see at least 3 months of pay stubs. And if you have a bank account set up for your loved one already, they're going to want to see that information to make sure that there's not too much money in there. Even if it's only a little bit, even if they've only worked, a couple hours in the past 3 months, that doesn't matter. Just be forthright and honest. You might even want to, and this is a little extra, but we are a little extra. You might want to check with your child's doctor to see what is in the medical history, what's in those files, and make sure that it's accurate. All of the stuff in your child's medical record is accurate. You can look at the Social Security Blue Book. This is another link for you for the criteria that they use to say, yes, you have a disability. So in the Blue Book, for example, you'll open it up and you'll see listings of possible diagnoses, things from muscular diseases to cognitive disabilities and everything in between, autism, cerebral palsy, whatever. There's a listing of all these different conditions. You look at all of your loved one's diagnoses, and it will say things like, for example, they have to show a marked inability to hold conversations or, follow through on tasks or, whatever. But you have to make sure that they know in the application that your child meets the Blue Book criteria. So check that out as you're doing your application and maybe even use some of the same wording. There might be a form called the SSA 1696 that you as the parent are going to have to sign to be authorized to talk to the Social Security Administration about your child's account, especially since they're probably going to be over age 18. When you apply for SSI, again, it can take up to a year unless your child has a presumptive disability. There are certain things that when they see that your child has this disability, they're going to move quicker. They're going to be able to move quicker because they don't really have to do as much digging. So, for example, if you can show that your child has an IQ below 70, that IDD is a presumptive disability. If they have cerebral palsy, that's a presumptive disability. If they have lost a leg at the hip, if they're confined to a bed, there are several things on the list, and you can check by clicking the link. You might get a denial letter pretty quickly after you apply for SSI. What they don't tell you is that you're actually applying for both SSI and SSDI at the same time. If your child is 18 and you haven't turned on your Social Security, your child will not qualify for SSDI, and we don't want them to. But some people panic when they get that letter saying that you're denied SSDI benefits. Just make sure you look carefully at the letter. Reach out to us if you need help with that, if you have questions. Your local office will take care of putting together your application materials and send it all to Austin, to the Disability Determination Services Office. Those are the people who are going to really dig in there, look at all the medical records, look at your file, and determine whether or not there is a disability. And you can even call DDS and check with them to see if they have everything that they need to make that determination and who has been assigned to your case and if there's anything you can do to help them along. When you finally start getting SSI benefits, what are you even doing all of this for? Well, for 2026, the maximum monthly benefit is $994 a month. Now, if you're married, if you have two individuals with needs who are married, you would think that they would each get $994 a month, but that's not the case. This is one area, again, contact your elected officials and tell them that this is unacceptable. Married couples should not get less money than two individuals, but that's currently the way it is. Now, when you receive SSI, you also receive Medicaid. So your children will automatically be able to get Medicaid when they get SSI. All right, before we get into how other things can impact your SSI, I want to just catch up with some of the questions in the chat box. I answered how to get on the CFC waitlist. What about when a person dies before they turn on their retirement benefits? Do our children qualify for SSDI in that case? So yeah, sometimes we have a parent who passes away. If the child is a minor and you as the parent pass away, your child will get benefits based on the fact that they're a minor and that the parent has passed away. Any child can get that benefit. Now, when your child with needs turns 18, or, sometimes those benefits last a little longer, like through high school. So if your child doesn't graduate till they're 19, they might still be able, and they're neurotypical, they might still be able to get that benefit. But when your when your disabled child graduates or turns 19 or 18 or, somewhere in that time frame, the benefit might stop because now you need to reach out and let Social Security know, hey, my child was receiving this benefit because a parent died while they were a minor, but now they need to continue to receive the benefit because a parent died and this child is disabled. In that case, when a parent dies and the child gets SSDI as a minor, it's kind of not a good situation because you miss out on SSI Medicaid. If you don't get Medicaid through a waiver or someplace else, you could be locked out of Medicaid. So that's kind of a concern for us. So be careful with that. Now, if the child, young adult, I use child just to say the next generation, right? I don't necessarily mean a 5-year-old. If the individual with needs is beyond age 18 and they've already got SSI and Medicaid, and maybe they've been on that for a few years and then the parent dies, that's totally fine. There are no issues. The individual would switch to the childhood disability benefit. My child gets SSDI after working. Her dad is pulling SSDI. I don't know if she's getting SSDI based on her work history or her dad's. How do we find out? You can log into the Social Security portal and look up her record, look up dad's record, and maybe figure it out that way. There's also something you can request from Social Security called a BPQY. It's a benefits query that will tell you what you're receiving, and we can help you figure out why. That's the BPQY from Social Security. We created an account on yourtexasbenefits.com, but they cannot verify the identity. This is a very common issue, especially if your child doesn't have their own cell phone or if they don't have an ID yet. You're going to have to call and work with the Social Security Department, unfortunately, to get that resolved, or keep trying various methods, or just use our program. Why don't individuals with SSDI automatically get Medicaid? Well, you get Medicaid through SSI and through the waiver programs. You can also get it as a buy-in, but when your child is receiving SSDI for 2 years, they'll be eligible for Medicare in addition to the Medicaid that they should have already been getting. And why? Because that's the rule. That's all I can tell you for right now. Now, if your loved one is receiving SSI and they're working, they can make some money, but they just can't earn more than $1,690. That's the limit, $2,830 if they're blind. But this is how they kind of formulate how much your child will get if they're working. They take off $85 off the top. They ignore the first $85 of earnings. Then whatever's left over after that $85 deduction or exclusion is divided in half. That brings us to about $557 in this math equation. Then you subtract that number from the total benefit available, and this person would be getting about $436.50 payable in SSI benefits. Another thing that could impact how much you get from SSI is if the child is working and still regularly attending school. If you're still going to school, you can work a little bit more and earn a little bit more before they take away your SSI. You have to ask for it. It's called the Student Earned Income Exclusion. You have to ask for this. They're not ever going to automatically give it to you. They're probably not even going to think, oh, you just told me they're in school, and oh, you just told me they're working. Do you want this benefit? No, you need to tell them. Another thing that can impact that amount of money that your child should receive is child support. We all know divorce is very common. It's even more common in families in our community. In the special needs community, the divorce rate is much higher. If you have child support continuing beyond age 18, which is common with people with disabilities, that child support beyond age 18 cannot go directly to the child because SSI considers that income. Now, after age 18, that's where it's supposed to go, to the child. So what do? We set up a first-party special needs trust. And we have those child support payments redirected to the special needs trust. If you're going through the process of divorce, it's way easier to set this up on the front end. If you've already been through the divorce and you need to amend your divorce decree to have this change made, you might need to do that. You might need to consider contacting your divorce attorney or a special needs focused attorney or both, so that the special needs attorney can set up the first party trust and the divorce attorney can make sure that the child support is directed there to that first party trust. You have to do it by a court order. So get that done as soon as possible. So what happens? What are the Social Security benefits for disabled adult children? That's CDB, Childhood Disability Benefits, or SSDI. How does that get turned on? And when does my child switch from SSI to this different benefit? Well, if the parent receives their retirement benefit or disability benefit, so let's say you're in your mid to late 60s, you turn on your Social Security retirement benefits as a parent, your child will start getting about half of the amount that you get. It doesn't take away from your benefit, it's an additional benefit. Or if you as a parent become disabled and turn on your disability benefits, the child has to have that disability that started before age 22. And there are family maximums that you have to consider. Now, when you as the parent pass away, your child's amount is going to go from 50% up to 75%. And they're going to get that money for the rest of their lives based on your Social Security work record. We can help you determine exactly when the right time to turn on your Social Security is. Most people think that if they wait until they're 70 years old, that's the way to get the most that they can out of Social Security. And that is true for people who do not have a child who will be receiving benefits. But if you have a child with a need or a disability and they can receive benefits, it is not the best idea for you to wait to age 70 in certain circumstances because of all of these additional benefits. So we can walk you through that. That's part of the planning that we do. All right, let's get some questions answered. I have applied for my child class through MHMR. When I log into yourtexasbenefits.com, where and what do I need to see the timeline information? So if you've already put your child on the wait list, you create an account on yourtexasbenefits.com for your child, not your name, your child's name and information. Then you log in and you're going to go to manage. You'll see a button for manage, and then you'll see interest lists. So you want to go to manage and then interest lists while you are logged in as your child. My child was denied for Medicaid while on SSDI. Sancia, I don't know the precise reasoning for that. If you would set up an appointment with me, it's completely free. We can talk through what happened there and what benefits and resources your child is already getting and what you might need to do to reinstate that Medicaid. Repeat your answer to the cannot verify identity question. A lot of people do get that error that they cannot verify the child's identity through that ID.me or whatever it is. We've heard that a lot. So make sure, if your child has a state issued ID, that would help. I've also heard something about if your child doesn't have their own phone number, that can be creating some issues. I don't really know precisely, but you might need to work with the Social Security Administration to get that figured out. And I'm sorry, because that's not going to be fun. Does this apply to adult children with adoptive parents? Great question, Erica. Adopted children actually get more benefits. For example, did you know that if you have a child who was adopted through the state, they get free college tuition? That's pretty cool. The other thing to know, to answer your question, yes. Benefits under a parent's record, that can include mom, dad, stepmom or dad, adopted mom or dad, or adoptive grandparents. Any of those things would count for these benefits. But like I said, this is really important because this is money that your kid gets the rest of their lives. We want to make sure it's as much as possible. So in order to get these benefits, you have to be 18 years old or older. You cannot get SSDI CDB benefits as a minor. It's called something different. It's a different program. You do have to have a disability that started before age 22, and the parent has to have worked enough to earn income. Now, if the parent has not earned enough, what happens? We get that question a lot. Your child might get both SSI and SSDI at the same time. If the SSDI benefit that's based on the parent's work record is not high enough to be higher than SSI, then your child can get a little of each. Look at what I see here. The next bullet point. Your child cannot be married and still receive the childhood disability benefit. And they can't have previously worked enough to earn their own Social Security retirement, which is that $16.90 a month for an extended period of time. When you start receiving that SSDI, SSI typically goes away as long as the amount is high enough. You'll be eligible for whichever one is higher. And after 2 years on this type of benefit, your child will receive Medicare in addition to Medicaid. You might have to refile a form, the H-1200 application in Texas, and mark the box that says MEPD, Medicaid, something like that. If you ask us, we can let you know what those exact words are. But it's for Medicaid for the elderly and disabled people. So MEDP is what you're going to need to ask. If an adult child earns above the substantial gainful amount and therefore doesn't qualify for SSI, does that mean he will not qualify for waiver programs? No, that's completely different. Two separate things. You can qualify for waiver programs even if you don't qualify for other things. Calling the Social Security Administration when you can't get verified is not very helpful. Oh, they refer you to the ID.me people, okay? Can't get an appointment at the local SSA office. I wait for hours. Our recommendations when you call Social Security, your local office, call as early as possible in the morning to get on that. Hopefully that way you can call early enough to be in the queue and not have to wait as long. You might even need to call, if they open at 8, start calling at 7:30. Other than that, do reach out to the ID.me people and work on that because it's really so important. It's worth the effort and the hassle. ABLE accounts. Before I get into ABLE, Janet wants to know what the difference between the waiver program and DADS is. DADS is an old name. They just don't call it that anymore. Okay. Maureen, I see your question. If you're approved for SSI, how often do you need to redo paperwork or have check-ins? Usually about once a year. But anytime something changes, you need to let them know as well. ABLE accounts. ABLE accounts, we do entire webinars about this. So if you want to dig deep on ABLE accounts, you can go watch the webinar about that. But this is a great way that you can save up some short-term savings for your loved ones without affecting their SSI or Medicaid. It's a tax-advantaged savings program. You might have heard of a 529 college savings plan. That's a 529C. The 529A is the ABLE account. You can use the money that you set aside in the ABLE account to pay for anything that your child needs that will help them have a better life. That's what ABLE stands for, Achieving a Better Living Experience. The child is the account owner, but again, it does not count towards their SSI and Medicaid limits. The income that's earned in that account is not taxable. You can put in $20,000 for this year, but you never want your ABLE account to go above $100,000. And when your child passes away, if there's money left over in the ABLE account, Medicaid can come back and claim reimbursement for some of that. So for 2026, they've changed some rules about the ABLE account. You have to be 46, or the disability has to have begun before age 46 for the ABLE. You can put in $20,000 for the year. You can put in up to $15,650 additional money if you earn that much at work and you do not have a retirement plan at work. So if your child is working and they make that much money, they can put it into the ABLE account. If they only make $5,000, then you can put in $5,000 extra dollars into the ABLE account, but still never more than $100,000. If you already have a 529 college savings account, but now you're seeing that an ABLE might be better because it's more flexible, you can definitely easily just roll your 529 college plan to a 529 ABLE account. And there is a federal tax credit for contributions made to the ABLE account. Some states also give you a state income tax credit, but of course, since we don't have state tax in Texas, you don't get that here. Now, CPG can open an ABLE account for you. We don't charge you anything to do that paperwork, but it is $250 minimum to open that ABLE account. And there are ABLE accounts all across the US. You don't have to choose the one that we use. If you want more information, just set up your meeting with us. These are some of the highlights, the main differences between the ABLE account and the third-party special needs trust. Limited amounts that you can contribute to the ABLE account. Remember, I said $20,000 for this year, $100,000 total. For the special needs trust, it's unlimited. You could put millions, billions in there if you want to. There's no limit on how much money. The ABLE account is funded with cash. Anyone can put money into the ABLE account for an individual, including that individual. With the special needs trust, you can put in assets, investment accounts, houses, whatever, life insurance. And anyone can put money in except for the beneficiary. This must be money that other people are giving to the beneficiary. With the ABLE account, it's under the beneficiary's control, probably with a parent's guidance, but they're able to get money from their ABLE account. The special needs trust needs to have a trustee. Now that can be a parent or a family member. It can also be a corporate trustee or a bank. ABLE, you can literally use the money for anything, including housing. There's a special rule, though, about that third-party special needs trust paying for housing. And this comes with SSI. If your child is still receiving SSI, they have to be paying some money towards their own housing. If you use the special needs trust, the third-party trust to pay for housing, that's not your child's money, so they don't get that additional 1/3 benefit. So don't use the third-party special needs trust to pay for housing if you're still on SSI. I know it's a little confusing, but we can help. The ABLE account is tax advantaged. It grows tax-free. The special needs trust does not have that advantage, and those income in that account, the gains are taxed. And then finally, about that Medicaid reimbursement clause, the ABLE account, the state can come back and claim reimbursement against money that Medicaid has paid for your child. The third-party special needs trust does not have that clause in it. I'm going to go through these last couple slides and then get the rest of the questions that I can. These are some of the topics that we cover and things that you need to keep on your radar as it relates to planning for the future for your loved one. When you look at this later on, if you have questions about any of these topics, Hopefully some of our upcoming webinars might be able to help you, or you can reach out to us for answers. This link will take you to our website where we have listed out our upcoming webinars, and you can pre-register, which is really helpful because then you get the confirmation link. You can put it in your calendar. You can have reminders sent to you. You can submit questions ahead of time, and you get those slides and a link to the video later on in your email. This is our new SSI and SSDI support advocate, Jessica Alvarez. We can help you complete your SSI and SSDI applications, whether you've already started or you haven't yet, whether you're doing a plan with Consolidated Planning Group or not, you're going to be able to get help with your SSI applications. This is our whole team at CPG. And finally, this screen I'm going to leave up as I answer the rest of your questions so that we can get everyone scheduled for their free consultation. This is over Zoom. It's usually about 30 to 45 minutes. You're going to meet with me or Andy Morris, my husband, or Allison Skauberg, the owner of the company. And we're going to guide you through whatever questions and concerns you have up front. We're going to give you some advice based on a survey that we ask you to fill out. And then we're going to talk to you about you and your family and what you need to do and what we can do as a company to help you move forward, help you on your journey. We can put together full planning services and all of that. Of course, the links are here for our social medias. You can use the QR code. You can call or email the office, or you can call or email me directly for your free consultation. All right, the last question. So please, if you have any more questions, or if you sent it in ahead of time and I didn't get to it yet, put it in the chat box. Erica says, I assume that the ABLE special needs trusts are recommended for all, but you would especially recommend using ABLE if a family makes more money that allows SSI Medicaid benefits prior to the age of 18. So the best way to think of the ABLE and special needs trust. The ABLE is like short-term savings for your loved one. It's easy to get to. There's no limits on what you can spend it on, and it has to be kept a pretty small amount in the grand scheme of things. So the ABLE is like the savings account that a person would hold at their bank. You have checking and savings at Chase Bank. This is what I want you to think of the ABLE account as. When you need more money in the checking account, you can pull it over easily from the ABLE. If you have excess money in the checking account, especially if you're getting close to that $2,000 limit, you just shift it into the ABLE. I want you to think about the special needs trust as your child's retirement fund. After you are gone, then they can use the money that's in their special needs trust to pay for housing and care and everything else that they're going to need for the rest of their lives. The special needs trust should be long-term savings. Can you recommend a place? Oops, hold on. Are you able to provide an interpreter for the consultation who speaks Spanish? Unfortunately, we do not have anyone on our team who speaks Spanish. Jessica might be able to help, but if you have someone who can help, you are more than welcome to bring them to the meeting. Can you recommend a place to get a 3-year-old evaluated for autism? Yes, if you set up an appointment with us, we can share some resources on where to get evaluated. If you don't want to go through a whole consultation with us, just reach out to your child's doctor or school, and they're going to be able to help you as well. Would it be best to have both the ABLE account and the special needs trust? Absolutely. That's what we want our clients to do, both the ABLE account and the special needs trust, because they do serve different purposes. Whew, that was a lot of talking, but I think we made it through all the important information. Listen, I did a webinar yesterday about ABLE accounts. If you have questions about that, feel free to go to our YouTube channel and check out that one. Tomorrow's webinar is going to be me presenting again, and we are going to be talking about, I'm sorry, tomorrow we're going to be talking about educational options after high school. So feel free to join me for that. I hope that you will schedule your free consultation. I would love to talk to all of you and help you. Have a great day. Thank you all for being here with me today. Hope you found something helpful. Bye-bye.